5 minutes.
Thank you very much, Mr. Chairman. Thank you all for being here this morning. I am curious, as Congresswoman DeGette was talking about the FDA, and she's right. They're not going to just try one door; they're going to try all the doors. So I would hope that they would be included. Maybe y'all can help me out. I'm listening to all these initials being thrown around. This is not an area I'm comfortable with. HKIC versus Healthcare and Industry Cybersecurity Task Force that was called upon to be set up as a part of the Cybersecurity Act. What are the differences in those two?
Yes. So the HKIC is a simply easy way to say the large mouthful. The HKIC is an organization within HHS, and it is responding to, as I mentioned, the specific the recommendations in the CISA Act, which asked the Cybersecurity Information Sharing Act, which requested the agency or required the agency to establish the ability to do real-time sharing of threat indicators with the sector. So that is what the HKIC does with respect to the CISA Act.
All right. And then any of y'all can answer this who feels comfortable with it, but the Healthcare Industry Cybersecurity Task Force that was supposed to be set up, what is that doing and how often do they meet?
Okay, the Healthcare Industry Cybersecurity Task Force, again, was established as part of the Cybersecurity Act of 2015. It had a very segmented period of time. It was literally by the legislation to only last 12 months. So we completed our work earlier this year. And during that time, we met at least monthly with both industry as well as the government to inform and advise the 21 members of the task force in the creation of this report of really looking and analyzing the challenges facing healthcare sector in
and we appreciate that the report came out. So you're telling me that you met at least 12 times during the year, maybe
a
some
lot more than 12, but the minimum was 12.
Okay, could you get us a number on how many times you met?
It is actually in the appendix of the report. You will see every single meeting that we had and who attended.
All right, I appreciate that. And can you tell me how the representatives were selected to be on the task force from both the healthcare sector and from the federal government?
We did an open call of interested individuals for that. I believe Mr. Kern actually arranged the scheduling of all of that, but we had over 100 candidates who were self-nominated or nominated by their organizations. We formed a joint working group with NIST, DOD, DHS, and HHS to look at the candidates and find candidates who represented cybersecurity practitioners in the field. We identified 4 federal, each of those 4 agencies I just mentioned, nominated one person to represent the agency, and then those representatives, along with members on the task force, identified 17 of the over 100 candidates who were interested in the positions who had clear cybersecurity roles as part of their duties. We're not just executives, but we're actual practitioners and would represent various parts of the industry. If you look at the legislation, we needed to represent certain fields. We wanted to look at medical devices. We wanted to look at providers. There was a range of capabilities that we wanted to deal with. So that's how they were done. We narrowed those down. We made sure that all of those members could be committed for a year, and that's how it started.
Well, I appreciate that. Now, they came out with a number of recommendations and 6 imperatives, and curious what action is now being taken to see that those 6 imperatives are addressed. Fortunately, it's in the stuff that we have. And the first one is define and streamline leadership, governance, and expectations for the healthcare industry cybersecurity. What steps do we take now? We've got a report. What's next?
When we look at it, basically the department, HHS, has had representatives throughout the course of this activity supporting the program. So although I was the government co-chair for the activities, each of those organizations have leadership representatives. They have membership on the cybersecurity working group established within HHS. And everybody is basically looking at those, and the task force recognizes there's a lot there, more than we could ever possibly do in 1 year. And really, each of the groups are now stepping back and saying, how do we prioritize these? Where do we find the resources for these? And that is kind of an ongoing conversation that's going through the cybersecurity work.
And as that conversation goes on, as Ms. DeGette said earlier, you all need to let us know what we need to do, whether it's legislation or otherwise, so that we can assist you in that, because making sure that, as you've heard from some of the other questions, making sure that our health records are secure and making sure that we don't have folks who block us from getting to those records or are using them for ill purpose is extremely important to all of us. Thank you, and I yield back.
Thank you. Now recognize Ms. Castor for 5 minutes.
Thank you, Mr. Chairman.